We've talked before on the show about anterior BruxZir and how it's more translucent than regular BruxZir, and of course you can see the anterior BruxZir sticker on the outside of this case, and so it's an interesting case because the doctor prescribed it, and I want to show you what happened here. Let's take a look at the impression. We've got an anterior double arch tray, and looks to be done simultaneously with both viscosities of materials. When I hold it up to the light, I can see that the patient did bite down all the way, and so we've got a pretty darn good impression here. Let's take a look at the model. Nice prep. Good looking prep. Good looking reduction. That's plenty of room for BruxZir. That's plenty of room for e.max. That's really plenty of room for anything. And we always look, one of the things technicians always look at is, and this is something that's a little hard to see in the mouth. It's much easier to see on a digital impression, for example. So when I do, like if I take a digital impression of this tooth, I will always look at the virtual model on the screen from this angle and then try to take the most facial part of the preparation and look at it with the adjacent unprepared tooth next to it. This spot right here, the junction of the incisal third and the middle third, is a really easy thing to leave too bulky. And a lot of times it's once you get the stone model where you compare where this is compared to this to go, ooh, we may or may not have enough room here. It looks like we have enough room here. In that reverse prep technique, I do put a depth cut right here at the junction of the incisal and middle third to make sure that we don't get kind of a Bucky Beaver prep. And you can see how this prep along the facial surface in the incisal half does in fact tilt back towards the lingual, which is nice. So far a really great job from the dentist, and we sent the dentist an anterior BruxZir crown. Let's take a look at that. So maybe hard to see here, but definitely a little more translucent than regular BruxZir. And the issue was it was being placed on a tooth that had had endodontic treatment. And when the doctor put it in place, even though this is an A1 shade, which is the shade the doctor requested, it did not look like that in the mouth. And the dentist sent a picture along to show how grayed out that anterior BruxZir crown became when it was placed on that dark stump. And again, here it is in place with the A1, the Vita A1 shade tab next to it. And this is something that we know about anterior BruxZir and e.max for that matter, that as you get a more aesthetic material, it therefore becomes more translucent and as a result can show the tooth underneath it. So how, as a dentist, do you know when you have to worry about that stump shade or not? Well, what we use in the lab is what I think is pretty much the standard, and that's the Ivoclar Vivadent natural dye material. If you used to do Empress veneers, you might have an old one of these with ST on it, which we used to say for stump shade. But if you flip the new one, the natural dye guides over, you'll see how these shades relate to what was really those ST shades was the Empress stump material. Stump with an F. Thanks for the Germans for throwing that in there to make it impossible to pronounce. And you can see how those older ST shade tabs for the Empress stump shade compared to the new natural dye material, as it's called. And so really this is what we use now. We talk about the ND shades for the natural dye because they sell, of course, this in dye material as well that we can put on the inside of a crown like this to check it before it goes out. So my advice is if you're going to be doing more translucent anterior restorations like e.max, like anterior BruxZir, this is a really good investment to have one of these stump shade guides. You're not going to find that there's a ton of teeth that are dead ringers necessarily for these shades, but really if you just pick the closest one, so on a tooth like this, it's probably this, when you get that kind of blackish look or dark gray look, and really just a photograph of the ND9 tab next to the tooth so our technician has an idea of how dark it is compared to this. And they can even combine these together to make their own shades. But pretty much the rule of thumb here is that once you get south of, say, ND4. So all of these over here, the 5, 6, 7, 8, and 9. If the stump shade is, you know, a really dark gray or a brown, or this one actually, even though it's, you know, not an, you know, awful shade of yellow, perhaps, again, the value is so high that that's going to show through those crowns as well. And so these four, you can get away with almost anything on top of it, you know, whether it's e.max or anterior BruxZir. In this range, it's going to work fine, but you're going to get grays and other colors bleeding through on the 5 through 9. And the more important thing to think of, besides just what, you know, shade these each happen to be, is if you're going to try to go from these shades, like this patient was, going from a stump of an ND9 to an A1. That's a huge leap, you know, if you kind of took like a Vita shade guide and held it over here. You know, when you get down into these shades, we really can't go more than about 2 shades lighter, say, in terms of value. So to go from any of these to an A3, A3.5, you know, would be fine. A2's a stretch, A1's a no-no, and B1's definitely not going to happen. So it's not just about what is the stump shade. It's about how big the spread is between the stump shade and the final desired shade of the restoration. You just can't make that huge leap to A1 from these shades. Not with e.max and not with anterior BruxZir. We've actually made the we made the doctor a regular BruxZir crown that we're going to send out now. So they're going to be able to place that on and not have to worry about this color influencing that final color like we saw it happening here. You can obviously it's clear as a bell to see that kind of dark shade bleeding through there. The doctor could, if they really wanted to have a, you know, more aesthetic crown such as e.max or anterior BruxZir, have gone in and actually done some add some white composite to the front of that preparation and kind of opaque it and keep it from showing through. But I don't know, that seems a little dicey kind of at times. And yes, we could probably put some internal opaque on the inside of the anterior BruxZir crown. But again, that's just a little bit dicey too. And probably the safer thing is to use a less, you know, translucent material. And so, you know, I took this particular patient's solid model and put some black on there. And you can definitely see the difference when the crown goes into place, you know, with that Sharpie on the background, how it really kind of dulls and darkens things. And, you know, it's one of those things that, you know, you really don't know until you try it in. But I think, you know, like I said, if you're going to be doing, you can really kind of almost see the prep outline showing through there when you look at it like that. If you're going to be doing these more translucent restorations, it is really helpful to have this, the natural dye shade guides in there, and let your lab know, you know, if you're down in the 5 to 9 region, and certainly take a picture, just like you would take a picture with the A1 shade tab in place, saying here, you know, we want to match this. See, here's the A1. I would have liked to see the shade tab over here next to number 9, if that's what we're trying to match, so they can see number 9. But you're going to also take one of the prep itself with one of these in, and that will ensure that not only does the technician see how the final crown should relate to the shade tab, but also how the prep itself relates to it. And that will allow them to either possibly opaque the inside of the crown, or more likely suggest the use of a less translucent material, such as regular BruxZir, so that you can in fact block out that dark stump shade.